The World Health Organization says the chronic global shortage of personal protective equipment, or PPE, is now one of the most urgent threats to our collective ability to save lives. Without that gear, healthcare workers get sick. In some cases, they're dying. PPE and ventilators are now a far more precious commodity than oil. We're hearing already about rationing and shortages in Canada. And as Abigail Beeman reports, some doctors are even soliciting donations.
We have over 10,000 hits across those websites. It's essentially a resource for the public to know what they can donate.
Dr. Sunny Johal is an emergency physician so concerned about personal protective equipment on the front lines, he started Mask a Hero, connecting donations with hospitals in BC and Ontario that need them. Some hospitals are already rationing masks. Thursday, Prime Minister Justin Trudeau promised more equipment.
Millions more items that are necessary.
But when will they actually get to hospitals in need?
And I can't give you an exact time or date for all of the various pieces and types of equipment, but rest assured that we're looking across the globe and also obviously in Canada.
The federal government is working with the provinces and territories and their different needs as officials everywhere stress the need to stay home and keep physical distance. BC now has early evidence that it's working.
The planning that's being done should allow us to adequately care for everybody who needs it. So much of that depends on us all doing our part to keep this from going explosively.
There is also worry about enough equipment for patients as well as healthcare workers.
We have limited number of ventilators. We know a certain proportion of these patients will require critical care and ventilation support. So I worry about that being exceeded and deaths being higher than they need to.
That scenario being planned for too.
We intend to have ventilators available to whomever needs them. But yes, we have an ethicist that is at the command table. We are building out an ethical framework.
Choices about who gets help, no one wants to have to make. Abigail Beeman, Global News, Ottawa.
It's obvious we can't wait to see what's coming to react. We know what could be coming. We've had 12 weeks to get ready, buy equipment, and restrict people's movements. Governments are preparing worst-case scenarios, and today, British Columbia made public its projections. If what happened in China or Italy happened in BC, would the healthcare system be able to cope? Eric Sorensen reports.
The Lynn Valley Care Centre in North Vancouver saw Canada's first death from COVID-19 and showed how the virus could spread. BC health officials are modelling expectations to manage this unpredictable virus. They're comparing BC with outbreaks elsewhere. That's BC's new cases where the star is. It's nothing like what is happening in northern Italy, the blue bars. But officials have to be ready for the worst. They would hope to maximize the number of beds to some 20,000. Then they could handle a South Korea-type epidemic with beds to spare. Only in a worst-case scenario, like northern Italy's hospital-based epidemic, could there be a shortage of beds.
The most serious model, the northern Italy-type epidemic, the hospital-based one, which we do not foresee, but which we have to prepare for. You see a shortage of beds here and only here.
In every jurisdiction, this is the big risk, a surge in COVID-19 cases beyond the capacity of the healthcare system, beyond the capacity of your local hospital. You can get more beds and more ventilators and increase that capacity, but what needs to happen is for people to stay at home to reduce the spread. That will bring the peak of the curve down so hospitals can manage the crisis. It would be for a longer period, but could avoid a worst-case scenario.
Saskatchewan has also modeled what could happen if a quarter of its population got the virus. A leaked Saskatchewan Health Authority document stated, worst case, demand for acute services will exceed existing capacity for hospital beds, ICU beds, and ventilators. And the very worst case, a death toll of 15,000 in that province. But it's just a planning tool.
What actually will result in Saskatoon for the plan is not what's on that page. It was to give an example.
Health officials must prepare for all possibilities, and the public must be trusted to do what's right.
If we can, get these peaks flattened quickly by everybody just staying calm and being rational about our choices and what we choose to do, then it shows that we can be trusted to make good, sound decisions.
Some forecasts may seem alarmist, but public trust comes from knowing the honest scenarios, the best and the worst. Eric Sorensen, Global News, Toronto.
Another cruise ship is infected with the coronavirus, and more than 240 Canadians are on board. And 4 passengers on that Holland America ship have died. The Zaandam is waiting to navigate through the Panama Canal. More than 1,800 people are on board. About 150 of them, we're told, are sick. They will remain on board. The healthy passengers, we're told, will be transferred to another ship. The captain announced the deaths today. Holland America says the 4 people who died were older guests. We know you have lots of questions about this virus. Our Jeff Semple will continue to consult with experts and try to answer them. Email your questions at globalnews.ca, and our website also has a special page dedicated entirely to COVID-19. You can visit globalnews.ca/coronavirus.